Sustainability. I do like that.
I'll just start at the top, I guess. Hello. Welcome back to my channel. Today we're sitting down for tea with Dr. Priya Udayappan as she talks about her journey in medicine. She's from Fairfax, Virginia, lived in India for 6 years, where she attended medical school and graduated from classical Indian dance. She completed residency and a chief year in Omaha, Nebraska. She's a board-certified pediatrician, currently working at Kaiser Permanente on Oahu, Hawaii. She recently completed a 200-hour yoga teacher training through Complete Yoga Training. Priya is passionate about ancient Ayurvedic practices as well as proven scientific knowledge and blending both Western and Eastern medicine for optimal health. I think that a lot of our world today is polarized, either one side of the spectrum or the other, and I think we really need to focus on that gray area and kind of blending the two and finding that middle ground and balance to incorporate both approaches to medicine and healing. I think they're both important. Like anything in life, there are pros and cons to anything. So yeah, bear with me. This is my first podcast style video. Still working out the audio kinks and working on the name. Originally I thought sustainability time. It's a bit of a mouthful, so I'm still trying to figure out a name for the podcast. Let me know what you think in the comments below. Here we go.
I've always been drawn towards Ayurveda and health in general, which is why I feel like I went into medicine in the first place. But then kind of as I was going through my medical journey, I realized that a lot of the things that we were learning about were direct treatments to direct diseases and not necessarily preventative medicine or like root cause of things, which is what I actually wanted to learn about, like just living an overall balanced, holistic, healthy lifestyle, which is why I was really drawn to pediatrics, because at least at that age group, you can set a precedent and set them up for healthy adulthood where they don't have hypertension. Because I worked in adult spaces where they'd come in with a laundry list of like chronic kidney disease and stage 2 hypertension and diabetes, and they just weren't very compliant and almost felt like they were too far gone in a way. Of course they're not, but it just felt like you're just adding on more medication and more medication. So I thought pediatrics was at least a more preventative space, but even within pediatrics, a lot of it is our developmental milestones and things that you look at, but a lot of it is still treating diseases with medicine. But thinking about Ayurveda and my roots and even going to medical school in India, I was really drawn to naturopathic medicine, and I wanted to switch careers and go into that instead, because I was like, this actually prevents the things that we're trying to treat in Western medicine. And Ayurveda is a little bit different because it also integrates the mind, body, spirit all as one, whereas Western medicine kind of divides it into its certain parts. Knowing that it's an integrated physical space, it's still medicine for a disease, and the spirit is not a part of Western medicine at all. So Ayurveda is definitely more preventative, just living a more balanced lifestyle, whereas I think Western medicine, like I said, kind of treats certain diseases and really looks at pathology and the microbiology and then the pharmacology and pharmaceuticals that can help treat, versus Ayurveda uses more like herbalism and different energetics in the body and then attaching mind, body to spirit. Whereas in the Western world, it's very much your physical body, and then the mental health space is all to like psychiatry, psychology. We don't really integrate that. Like some things, we recognize that there's somatic diseases, so things that start in the mind that like show up in the body, but there's no organic reason for them to be having a certain pain or, functional like fibromyalgia, things like that come more from the mind. Like, we do recognize that, but the spirit piece, I think, is left out in Western medicine. I think if they see it as more like maybe religious or philosophical, it's not really integrated, whereas Ayurveda recognizes that as like a part and parcel of our human existence.
To kind of be able to weave more Ayurveda into our society, what do you think is the most attractive way to compel our Western society to open their minds to less familiar Eastern practices? And what do you think would be some of the roadblocks?
This is a great question.
It's hard to get people to open their minds about something different. This is different for a lot of people.
That's exactly what it is. With Western medicine, things have to be scientifically proven for us to come out and recommend them. So it has to be tested in multiple randomized control studies across the nation. You have to know all the side effect profiles. It has to go through such a rigorous process for a drug to come out to actually say, hey, this is indicated for this certain disease. There's so much testing and research behind it. Versus Ayurveda is an ancient wisdom, knowing science of learning from our natural world. So the principles of it are very different. And I think that's why it's so difficult for them to both mesh right now. And it seems a little bit black and white for it not to come together. But I think there are people within the Eastern medical space that recognize and appreciate the advancements of Western medicine, especially with like imaging studies or things that you can pick up on that could be really great tools in the lab work. Because when you go to a naturopathic practitioner here, they are going to recommend lab work, and for your insurance to cover that and to go through that, to recognize those things as those very real markers of our health, you need the Western medical system. So the Eastern needs the Western. Likewise, I think with the Western medical system, they can get frustrated. We really like answers and we're really perfectionists. We like to cure things. And when we can't, there's a sense of frustration or, oh, that's a difficult patient. Whereas maybe there's other modalities that we could offer if we had more knowledge in that, to be like, hey, maybe you should check out this route instead, maybe could be more aligned. But again, hard for, I think, Western medical providers to recommend that without the knowledge. So I think knowledge would be a big part of it, and research. So if there's any way to do more standardized studies within the Ayurvedic practices and prove that they work, I feel like that's the only way that I see them kind of both blending, or people like me that just truly are passionate and see the scope of things and just talking about it more and breaking barriers and being brave.
Yeah, that's awesome. I love that you're just kind of going for that change that leads in that direction.
Yeah.
And I think in general, that's where society's going. Would you say people are more willing to at least learn about it and try out other alternatives, like healing alternatives?
Yeah, I would say, it's variable, right? Because there's definitely people that are maybe in hospice level where they've exhausted their Western medical options and they're like, this isn't working for me, or there's a frustration and it's kind of a last option. Whereas really Ayurveda works better as a preventative day-to-day habits, being more balanced, than as like a last resort. And so there are people that realize the limitations of the Western medical system, I think, that turn to something else, whether it be Chinese medicine or herbalism or Ayurveda, and vice versa. You know, there are diseases that are easily managed with antibiotics for an ear infection. It's just something that you need immediate relief for, symptomatic relief for. I've seen those people come to the Western medical space. So there's intermingling for sure, but of course it's personal preference, and it's kind of our samskaras of what we think our health should look like and what we feel like works for us based on our own experiences is what we're drawn towards. And I think that's why there's that divide. My dream would be to have practices and spaces where they're both types of doctors working together and sharing information and seeing how things go hand in hand, where it doesn't feel like so black and white or like they're on different things.
Like the more options that someone can choose from and the more alternatives, the better.
And just to add to that too, insurance would be another big part of it, right? Because insurance doesn't cover any of your Eastern medical practices. It's almost always out of hand and they're always private practices, whereas the government really institutionalizes Western medical systems and health insurance. So there'd have to be some change from like higher up and actual rules and regulations and insurance. And so it'd be a big collaboration for that to happen. It's not profitable either. A lot of our Western medicines, they were discovered in nature. Like aspirin was from a willow bark of a tree, and so a lot of it was found in nature. Quinine, treatment for malaria, was found in nature too. Quinine, it's like chloroquine, primaquine, naloquine. Some of the stuff that's found like the early 1800s, but a lot of it is synthetically derived with scientists and researchers and labs, and for that you need the resources and financing, and for testing you need financing. And I think that's just the system that we're in, at least in America. Maybe in other countries it's different, but I see that as kind of being a barrier to really advance Ayurveda and integrate Ayurveda or just other holistic practices. I know.
Hung up on like money part of it, because that's just a huge driver for our society, unfortunately. Even if something cheaper could be more beneficial, they're not going to push that.
It's unfortunate, but I think with like pharmaceuticals and drug reps and what they have to put into it, they definitely want to get something out of it for the long run. But I just feel like it's so much better from the patient perspective to be treated with all different modalities, because you don't come into a doctor's visit and I think you can expect a symptom cure or a band-aid or temporary relief. And Western medicine, don't get me wrong, it does offer programs like healthy lifestyle programs, meeting with a dietitian, learning how to cook better, take care of yourself, but they're all still very surface level and prescriptive when we could go so much deeper than that. I think it takes a combination of people being more open-minded in both, funding from the government and affordability across, because you almost have to have money to see an alternative medicine practitioner unless...
So that's not cheap,
Yeah,
right?
that's not cheap either.
That's
It's not...
almost more expensive.
Honestly, no option is cheap.
It doesn't cover. It's not covered by the insurance.
It's not covered. Or you're paying for insurance and then you're getting kind of only one side of the table. So it kind of puts people in a position where maybe they have to choose for themselves, or it puts people maybe that only have a little bit more privilege to be able to have multiple options. And I think I speak from that place of privilege, to be totally transparent, to having gone through the Western medical system, but having roots and knowledge in the Eastern medical system and kind of seeing and wanting both for myself and my own health.
But to kind of piggyback off of that, what advice would you give to the general public or patients, or those looking for a balanced approach to health, like whether they're in a place of privilege or not?
I would say at least seeking out options, because sometimes we go into the Western medical system or a clinic and it can be kind of scary or intimidating, and there might be a sense of, if the doctor's telling me something, so it must be ultimately right. To come prepared with questions that you could ask, and asking about alternatives, asking about what happens if we don't do any treatment at all, asking about their prognosis so they don't feel abided to one path of treatment. Same thing with Eastern medical practices, maybe going in and just getting a consult and seeing what that's about and exploring it for themselves. I think for each person it's so different depending on what they're going through and what their needs are and what tools they have in their toolbox. But I always think explore all your options, try both of them if you can, and see how your body responds and what you need. And don't shame yourself along the way. I think a lot of times people can go into one thing expecting a certain outcome, or a different thing going into a different outcome, and are just really hard on themselves when they don't see things work. And Ayurveda takes a while to work, right? It's not an overnight cure. So you know when you're going down that route, it's for the long run. You're not looking for a temporary solution. But if you really need immediate relief, you're in pain, you have an infection, you have pneumonia, I think also depending on what you're going through, maybe choosing one or the other if you're in a position to have to choose one or the other, or otherwise at least asking for options and having questions. And if you find a Western medical provider that's a little bit more knowledgeable or open to talking about that kind of thing, that would be great, and vice versa.
What would you say are the biggest strengths and weaknesses of both Western?
I would say in like the Western side, just me being a pediatrician and vaccines, like that's not necessarily recognized or covered in the Eastern philosophy at all. Versus here, herd immunity is huge, or kind of things that we don't see anymore, like polio or mumps, that are actually vaccine preventable. I think there's a big fear among the Eastern community about vaccine preventable diseases, or just vaccines in general and side effects. So just some things that are not even recognized that are options in the Western medical society. Also the screenings they do for breast cancer or colon cancer or prostate cancer, just the routine pap smears that you get. Screening tools at certain ages, at certain frequencies are really, really important, because they pick up things early before your body is even aware of them or shows any symptoms, and to be able to treat it. Also preventative. I think screenings are completely preventative. It's under the primary prevention category. So we have the tools in Western medicine to be able to detect really, really sensitive tools and tests, labs, workup, things you can continue to follow. So I feel like that's a huge perk of Western medicine, and something that you do need, like I said, immediate relief for. There can be options, or surgeries, right? That's not a big part of Eastern medicine at all. If there's something you need an immediate surgery or procedure for, that could be curative for you. So has many, many pros there. Of course, the cons we talked about, not necessarily including the spirit or mental health pieces. And we kind of see a body for its parts. So looking about the circulatory system, or just the digestive system, or the cardiovascular system, we kind of look at things in different systems and not necessarily completely integrative, how one thing could affect the other. We're just learning about the importance of gut health, or things that Ayurveda has known is now being studied finally. Again, that research, that funding behind it for it to actually be brought to light. Blue light, stress levels, just things that we're learning about now, or inflammation, oxidative stress, these kind of buzzwords that you're hearing are now actually being studied and realized as real. So I think we're a little bit behind in that sense. And I think with Eastern medicine, it's vice versa, right? Eastern medicine is very integrative, very preventative, helps you feel overall balanced, but there's some things that they don't have access to, or that's just not covered, or the extensive imaging or testing. There's no overnight magic pill or cure, where Western medicine there are some. And so I feel like their strengths and weaknesses are almost the opposites. That's why I feel like an integrative practice would be so amazing, because it really would cover it all.
Society in general right now, there's a lot of mistrust with not only the government, but also with institutions and just information in general. There's so much information. What advice would you give to general public people like me who don't have your kind of background and knowledge? approach? Like, how do we know what to trust? And I know that there's a level of risk also that goes into information and trying something out. How would you say the general public should approach digesting?
It's a lot, right? Because you hear stuff from your doctors and your medical professionals, but then you hear stuff online and you hear stuff from your friends, and it's just like information overload. And these are things that are affecting your health, so not something to be taken lightly. I think looking at reputable sources and talking to reputable sources of people that have actually gone through the proper training in certain fields instead of speaking from their own experience, because our bodies are so different. So one thing that works for someone may not work for someone else at all. So some of the fads that you see about certain things, or be it topical products or something you take internally, could really be beneficial for one certain body type and really be detrimental even to someone else's body type. So some of it is trial and error if it's not too serious, right? If it's just a certain diet or lifestyle thing that you want to try to introduce and see how your body responds. But if it's something more invasive or intrusive or is going to impact your health more, there's so many online journals that are totally free looking at the Western medical stuff, like peer-reviewed scientific articles that it's science. It's just what it is. It's just real and it's just facts. So there's things to read up on that also talks about the adverse effects, because Western medicine always comes with a little bit of that, like pros and cons with how we treat people, but all of that is listed out. So it's really all laid out. There's really nothing to hide. And I know there's a lot of conspiracy theories or rabbit holes that you can go down, or groups that you can get into and get influenced. Even in Eastern medicine, talking to Ayurvedic practitioners who have actually gone through training to become that. It takes a long time to become a true Ayurvedic practitioner. So looking into credentials of people as you're speaking to them, because I think people are getting online and giving advice about diet and lifestyle as an influencer with no knowledge or background other than their own personal experience, which is fine, but actually could be harmful too. There's just no basis to it. So I think just like really being mindful of your sources.
Yeah, looking deeper and what's behind those sources and getting multiple opinions. Yeah, for sure. You have so much knowledge.
Oh, Angie.
It did record.
Yay.